Morning. It is 9 o'clock, so we'll go ahead and get started. People will continue to join, and that is just fine. Thanks for joining us today for this session of innovative approaches to school success that will focus on juvenile justice. I'm Christy Gagne, a program manager for Telehealth Rocks. Telehealth Rocks is a federally funded program that focuses on school behavioral health, and we do this by working on social determinants, supporting school-based services, and telementoring trainings just like this one. I've got a couple of housekeeping notes for you. This session is being recorded and we will send it to you afterwards. Your microphones have been muted and you can use the chat or unmute to talk at any time or ask questions. And then it's very helpful to track attendance if you make sure either your first and last name are visible on your Zoom screen or you type your name in the chat. That way we can track attendance and make sure we get those accurate certificates out to you. We have just a few disclosures and talking about the bias. We have no disclosures and everything presented today is evidence-based and currently accepted within the profession. And then just a note about after the session. So we will share the slides and recording with you as soon as we can. Just give us a little bit to get those processed. Those will go out through email. We'll also share them on the Telehealth Rocks website and on Facebook. The certificates of attendance will be sent out after the series ends in April. So we're tracking attendance all through the sessions and we will send those to you after the last session. Again, it's really helpful to type your name and your first and last name in the chat or to make sure that it's showing on your Zoom screen so we can get that right attendance. And then if you have any questions or need anything after the session, please feel free to email us at any time. I will go ahead and put that email here in the chat as well for you. All right, and then with that, I will hand it to Robert to get us started here today.
Hi, I'm Robert Stahls. I am the program director for Telehealth Rocks, which part of what we do is fund trainings and telementoring like this one today. And I'm really pleased to have two different programs with us, both working in Southeast Kansas. Michelle Alt is the fidelity specialist for the Restorative Justice Authority out of Pittsburgh, but serving multiple counties. And Brad Gerard is the Chase Program Director with Families Together Incorporated. And really excited that both are strong partners for the work that we do with Telehealth Rocks and meeting the needs of children and adolescents in Southeast Kansas and around the state. Next slide, please. So I went over this last month. Some of you may not have been here for that, but Telehealth Rocks really focuses on school and community partnerships to meet the needs of kids and their families. So all of these sessions are sort of current partners that work in different areas with us. And so really excited today to focus on youth at risk or involved with the justice system. Next slide, please. So basically, this is our vision. Really, we really believe that we are going to create schools and communities where every child and their family has the resources and skills they need to have the exact same opportunity. And you can see that our values are that we really believe it has to be comprehensive, it has to be responsive, it has to be expansive, receptive, and inclusive. Next slide. So why youth and families impacted by the justice system? So we've come up with some foundational concepts that all of the partners, there's more than 30 partner organizations that work together in this work. And we really believe that these are foundational to having this level of success with children and their families and really meeting their needs and allowing them to be successful both in school and in life. So we really believe that school districts, we are a rural program. We focus on rural areas with the other work that we do outside of training, which is open to anyone. So we really believe school districts are central to rural communities, especially when it comes to children and families. We believe that our work has to be integrated across universal, targeted, and individual services, has to be trauma responsive, that we have to meet the training and resource needs of our schools and communities and families and what you guys identify. Many of you, this training is a response to a survey we sent out in December asking, what are the areas you need help with? What are the areas you'd like to learn more about? And all of the topics that we're covering in these sessions came out of that and your responses to that. The system has to be integrated. One of the things I say a lot is that there's enough resources that we just have to help coordinate them and collaborate them. And one of the things we do is we don't really believe in creating new things. We believe in, first of all, looking around and seeing what's working and helping to trumpet that. So both our work with Restorative Justice Authority as well as our work with the Chase program, we didn't create that. We didn't invent that. They invented that, but we saw it as useful and needed, and really work to help trumpet that and also to help support that and help it grow across the state. And then we really believe that there are certain children and families that need specific focuses, that need more focus, that need more interventions than just general interventions that we want to offer to all children. And one of those groups, and the one you'll hear about today, is those involved with or at risk for the justice system. Next slide, please. So we'll talk to Restorative Justice Authority. We'll have Michelle Alt from there, who really excited to hear about their amazing work. Then we'll talk to Families Together and the Chase program with Brad Gerard. And then we'll open it up for your questions as well as some questions we've come up with. Next slide, please. So I'd like to pass off to Michelle Alt with the Restorative Justice Authority. So excited to have her present today. Please go ahead.
Thank you so much. I'd like to thank Roberts and Christy and Telehealth Rocks for giving us the opportunity to come on today and share a little bit about our programs. I'm Michelle Alt with the Restorative Justice Authority. I'm the fidelity specialist here. So I do our fidelity and quality assurance for all of our evidence-based and best practice programs that we offer here. I also do fidelity not only in Crawford County, but also in the 6th Judicial District, which covers the counties of Bourbon, Lynn, and Miami. And I also do fidelity for Labette and Cherokee County as well. But for the purpose of today, I'm mainly going to be talking about our programs located here in Crawford County. So I've been with Restorative Justice Authority for about approximately 14 years now. I started out as a juvenile supervision officer, providing intensive supervision for youth in the community that had been adjudicated of various offenses. And now I do, as I said, the fidelity for our agency. In 2016, Senate Bill 367, for those of you that aren't familiar with it, passed in Kansas, which really overhauled the juvenile justice system as we know it. That law went into effect in 2017. One of the major things that came out of Senate Bill 367 was they really wanted to reduce out-of-home placements. They wanted to have youth remain in the communities where they live. And with the money that they were able to save by doing so, they funneled that back into local communities for us to be able to provide evidence-based and best practice programs for those youth to keep them here at home with their parents and guardians. So that really opened the door for our agency to provide a lot of really great programs, which I'm going to share with you here soon. So yes, so next slide, please, Christy. That one. Okay. So a little bit about the criteria before I get started for our programs. We serve youth ages 10 to 17. They have to be residing in Crawford County. Although I will mention, I know there's several people on the call from other jurisdictions. Every jurisdiction in Kansas had the opportunity to apply for funding to be able to provide similar programs to ours. So you might reach out to your local juvenile justice programs to see if they're offering the programs within your community. I do know that in the 6th Judicial District, they are offering some similar programs, although they are currently just serving their youth within their organization, but they planned and intend to open it up to outside referral sources. So schools, community members to be able to refer. The same with Labette and Cherokee counties as well. And for us to serve them, they have to be what we consider justice involved. And what that simply means is they don't ever have to have been arrested or criminally charged for any behavior. They simply have to have engaged in a behavior that if law enforcement decided to pursue it, it could be a criminal offense. So again, if you have a youth in school that's been caught vaping, that would qualify. If you've got a youth that's physically fighting with another youth, that would qualify. So really anything that they're doing, just that they're on that path to potentially enter the justice system if that behavior continues, we can serve them. So next slide, please. Okay, so a few of our programs, I'm just going to kind of give a brief overview of some of the programs that we offered. For those of you that would like some more in-depth information, especially those in Crawford County, I had emailed a couple things to Christy ahead of the presentation. So if you want to, as I'm going through them, if you want to put your name and email in the chat and request that, we're happy to send that out after the presentation. So the first program I want to share about is Catch My Breath. This is a evidence-based youth vaping or nicotine vaping prevention program. This program is offered for grades 5 through 12. And I wanted to mention it is free for all schools. So anybody that works within a school in Kansas, you can sign up and access this material and be trained to provide it within your schools. It is typically 4 sessions in length for about 35 to 40 minutes per session. So it's designed to be delivered within the classroom setting. At Restorative Justice Authority, we do it for 1 hour, just spend a little bit more time on the material, and we do it for those 4 sessions. And then we also have a new program that we're going to be starting soon called What About Marijuana? Which is provided by the Change Companies. It's an interactive journaling program that really is going to help explore youth thoughts and feelings regarding marijuana, their decisions to use, and pro-social alternatives that they can use instead. And that program is typically about 8 sessions in length for about an hour. One thing I do want to mention about our programs is that we do provide transportation for all of our programs, except for Catch My Breath. That's the only one that families are required to get their youth to. But other than that, we do provide transportation, which helps a lot of our families out. We're able to take that burden off of them and get the kids out here for the programs. We also offer an anger management program, which has been really popular. Again, that's kind of self-explanatory. We teach them alternatives, on how to handle their anger, impulse control, frustration. That's an open group. So if anyone wants to refer, it means it's going all the time. We're currently offering that, I think, on Tuesday afternoons. And so that is also an interactive journaling program as well. Youth are provided skills. They're walked through mindfulness, deep breathing exercises, different things that they can do to help themselves in those situations where they might be a little upset about something. Decision Points, that is a program that we offer that really looks at risk situations and things that our thoughts and feelings, and again, how they impact our decision making. So it teaches 4 different steps within that to hopefully stop and think before we make a decision, look at who would care about our decisions and what they might think about our decisions, and our motivating factors behind our decision making. That program is typically for our higher risk offenders, which I'll talk about here in a minute. We also offer a mentoring program, which is pro-social activities involving our youth. And our program advocate, either one-on-one or in group settings. And we provide an educational services as well. So if you've got a youth that is justice involved, but is also maybe struggling with their education, lower grades, not attending school, things like that, we can help with educational services, which is basically we're working in conjunction with the school and with the family to help the youth improve those grades and get back on track. Our employment services, I'm super excited about this one. We just revamped this curriculum. It is going to be about 8 sessions in length, and it's really going to do a deep dive into how to apply for jobs, appropriate attire for jobs, how to work with supervisors and managers and other coworkers, especially when maybe you don't agree with a decision that's been made. There'll be a mock interviewing process as well, so the youth will get to have an opportunity to see how it feels to interview for a job. And so, yeah, I'm really excited about that. Like I said, we just revamped that curriculum. We also have a community service work program. This one's typically referred by the court system for those that, so probation officers and such, that youth that have court-ordered community service as well, yeah. And then with our family services and support, we developed our own program for this. We took concepts from wraparound and family engagement, and we blended them together to create our family services and support. So really, we're working in conjunction with the youth and the family to set goals and to help refer for services that they might need in order to help them be successful. So this one works with the entire family, not just the youth. So it's a little different in that. We also offer the Parent Project, which is a parenting class for parents of youth ages 10 to 17. And that is, we haven't been able to offer that one yet. We just haven't had enough interest. There will be a small fee for that. We haven't set that yet, just because of the workbook costs and things with that. But it's a really great program for to help change adolescent behavior. I know that when I was a juvenile probation officer, the one thing that I always was concerned about was the lack of parenting classes available for older youth. I know there were a lot of parenting classes available for younger youth in the community. And so being able to offer something for those older youth is great. And then Forward Thinking and Crossroads, those are both evidence-based programs. We offer multiple programs through those. They're interactive journaling. We offer programs in things such as like What Got Me Here, which really explores their decision making. What are the decisions that they've made that have led them, both positive and negative, that have led them to where they're at today, and kind of explore how they can make changes to help them be even, to do even better than they currently are. We look at responsible behavior. There's a class on handling difficult feelings, relationships and communication, substance using behaviors, victim awareness. So we really offer a lot of different programs, and those can be done in a group setting or individual. Kind of same with Crossroads, similar programs in like substance using, life skills, drugs and alcohol, and anger management. So as you can see, we offer a lot of different programs at our agency. So if anyone ever has any questions about what we offer or how those programs work, you feel free to give me a call or send me an email. My information is on the final slide. Next slide, please. Okay. This is our referral form. Again, this is one of the forms that I had sent to Christy ahead of time that we can email out. It's really simple. We just need some basic information on the youth. And then the reason for referral, what is going on with the youth, so that we can, make an informed decision on what programs might be best for that youth and their family. Next slide, please. Okay. Referrals can be emailed to, we have a specific referrals email set up, rjareferrals@crawfordcountykansas.org. So you can send any referrals there or questions that you might have. So for those of you that work in other jurisdictions, if you have questions about what might be offered or who to be in contact with to talk to those people in those jurisdictions, feel free to reach out to me. I'll be happy to help set you up with those people. Next slide, please. Okay. And then, so we offer a lot of different programs at Restorative Justice Authority. I'm going to highlight a little bit on our truancy intervention program simply because we're kind of talking about schools today. But just briefly, we do offer our juvenile intensive supervision, which is intensive probation for youth, and case management services. So for those youth that are out of home, because in some cases, youth still are out of home in the juvenile justice system. We also offer our immediate intervention program, which is a diversion program. And we offer juvenile intake and assessment services. We have a care coordinator, which is Pam Ritchie, who handles a lot of the programs that you just saw on those previous slides, and Jeremy Allen. He also handles programs. So those would be the two people that you would be working directly with if you made a referral to our agency. So a little bit about our truancy intervention program. We began taking cases in this in April of 2022. Our truancy coordinators work with youth and families ages 5 to 17 who experience chronic attendance problems, and to help establish better communication, help reduce conflict between the youth and the parents, improve parental skills, and help the youth better engage with families and their school environment through our family support program. And then the parents in the truancy intervention program do take a class called Preparing Our Kids for Success. It's a 2.5-hour class on some of the reasons behind truancy. As we all know, on the call, truancy is kind of the tip of the iceberg. So our program really looks at what's underneath that, what's really happening, what's going on, what's preventing this youth from engaging in school or being present at school. We've had a lot of success with this program. It's been a wonderful addition to our community. This is a program that we can only accept referrals made by the county attorney's office, the court system, or court services. So this is one of our programs that is not a community. The community does not have an ability to refer to. One thing that's great about this program is we're able, like I said, to do a deep dive into what's going on with the family and really build upon the family's strengths to help re-engage with the school so that the kids and the youth can be successful. Next slide, please. All right. And finally, just to wrap up, that's my contact information and my email address and my phone number. So if anyone has any questions or concerns, please feel free to reach out to me. I really appreciate the opportunity to come and speak today. Thank you again.
Thank you so much, Michelle. And, I think the biggest thing is, there are different programs in different jurisdictions, but we really, first of all, I think RJA is one of the best programs out there. I think they do some of the best work. But also just one of the things we're wanting to do is really present to you guys kind of ideas for things. I mean, truancy is something that every school is struggling with. Kansas rate, the rates across the country have really, for chronic, problem truancy, I guess I'll call it, have just skyrocketed since COVID. So many important things. And we're so excited. Anybody who wants to reach out to those in their community that may be working on this, one of our goals for this is to help you think of ideas, but also to help link you to those people in your communities that you might be able to work with on similar things to the things we're talking about in this series. So now
Robert,
it's time.
real quick,
Yes,
I apologize.
please,
I
Go
failed
right
to mention
ahead.
one thing I've got on my notes, if you don't mind, real quick. I just wanted to let everybody know with our programs, we do look at risk level. So we do an assessment with every youth referred. So those youth that are potentially lower risk, those youth are not put in the same programs as the youth who are higher risk. Because the research does show that, we shouldn't mix those populations. So I just want to, for anyone that was interested in that piece of it, we do a risk assessment for each youth. So, and those youth are put in programs specific for their risk levels.
Of course, that's an important point. Thank you so much, Michelle. So
I
now,
also wanted to add, Robert,
yeah,
sorry.
please, Sandy, go ahead.
I wanted to add that we have started doing some programming in our detention facility as well. So that's been since the new year. So that's been interesting. We've done Catch My Breath. Michelle can probably tell you better than I can what all we've done. But
yeah, and that's really, really new. Yeah, we've offered Catch My Breath. We've offered What Got Me Here. We've done Handling Difficult Feelings. So we've done different programs within the juvenile detention center as well.
One of the things I think we have to know about people working in juvenile justice, and may not have thought about it, but they get into this because they deeply care about kids, and they especially deeply care about the kids. One of the most amazing things that Angie Hadley, who also works with the RJA, said to me one time was, I don't want them involved with this system, but if they are involved with the system, I want them to see this as a beginning, as a start to the rest of their life. And so really, Justice can be such a strong partner because they want the best for kids as well. So speaking of that, really excited about sort of another justice affiliated program, and going to pass off to Brad Gerard with Families Together, the Chase program.
Awesome. Thanks, Robert. And thanks Telehealth Rocks and Christy and everyone for putting this together. You guys have been such great partners, and we really love being linked up with you all. And it's nice to see Sandy and Michelle. We got to meet one time a while back, and you guys do such great work. So thanks for sharing. So yeah, the Chase program is been going for 4 years. It's a program under Families Together. And Families Together, if you don't know, is the federally designated PTI, or Parent Training Information Center, across the state of Kansas. And we serve families with family members or children with disabilities, or sometimes the people we serve have disabilities themselves. And the Chase program was an interesting origin story because the Johnson County Department of Corrections had showed up to one of our education advocate trainings and kind of realized, hey, we're getting people into our justice system here in Johnson County, and sometimes they have an IEP, or sometimes they need a disability diagnosis, and we don't really have an expert partner there. And so that's how the Chase program really came to be, was the Johnson County Department of Corrections looking for a partner in the disability world. And so they came to Families Together, started the Chase program back in 2020. Next slide, please. And it's been an interesting few years because Robert and Telehealth Rocks have helped us evolve this work to Fort Scott, but originally it was just in Johnson County, and providing that assistance to families of adolescents and young adults who have those IEPs and 504s. It's a little bit different now in Fort Scott because you don't actually have to have a disability diagnosis to qualify for the program. So we're kind of in this experimental phase of the program, which has been really fun to watch it grow. But yeah, that's how it started, was in Johnson County, serving just justice-involved youth who have a disability or who need a disability diagnosis. Next slide, please. I see Robert giving Destry Brown the credit. It's true. So this is our wonderful team. Leah Holly, who's not on this call. I believe Natalie is on this call, and she's new to the team, and Jordan. But yeah, I mean, we love our team. All these people care so much about the people we work with. And as you know, the team is everything. The people are everything. Leah's been with the organization for 25 years or so, and she has children with disabilities, and one of which was justice involved. So the parents being able to connect with her is a really huge deal. Next slide, please. So what is it that we do in the Chase program? I like to say that the Chase program has three main pillars. The first one is going to be educational support. The second is the youth one-on-one support. And then third are the pro-social community events that we run. So we can dig into each of these a little bit, but that educational support piece was the foundation of the program since the very beginning. And that is, hey, there's a child who is possibly justice involved, who might need a disability diagnosis. Maybe they've already been diagnosed. Maybe they were in a detention center and they're trying to reintegrate back into school, and the IEP hasn't been looked at for a year or two. And so we're a part of those supportive conversations with the parents and the guardians. We actually attend those meetings with the school, and we just serve as their support team. So the parents and the families are always leading the charge. But if they have questions, if they need help clarifying, maybe even like mocking up an email or something to send to the schools, we help with all kinds of stuff regarding the educational support to make sure the youth is getting what they need while they're at school. Secondly, we do one-on-one support with the youth, which has been probably the main growth area over the last couple of years, because we realized that the families love and need the support, and they're like, heck yes, they're trying to manage their own lives, their day jobs. Now they've got court dates and they've got IEP meetings. There's a lot going on, and so the guardians are like, yes, we need your help. The youth, maybe not so much. They think, well, what's in it for us? So we started to really dig in and say, how do we engage with these youth in ways that is exciting and meaningful? And so I'm excited to share about some of those. And then lastly, we know post-COVID and even pre-COVID, there was a lot of feelings of isolation. And so we focus a lot on pro-social events. Sometimes those events have a direct outcome. Sometimes it's just to hang out and let our hair down a little bit so that they know the people on the other side of the screen. And I'm excited to share more of some examples there. But next slide, please, Christy. So educational support, I chose this picture of this woman here because this is kind of the vibe a lot of times. The executive director of our organization likes to say that you don't call the doctor when you're feeling great. And that's kind of the same thing for us. Unfortunately, you don't get referred to our program. Generally, if things are going amazing, there's kind of some frustrations and some stress there. Luckily, we are here to support you. Next slide. And we do that through going to those IEP and 504 meetings. We've been in a lot of manifestation determination reviews to see if what's going on is specifically related to the disability. We've brainstormed lots of different conversations about alternative settings, if there was like a suspension or expulsion kind of thing happening. And yeah, that is one of the main meat and potatoes. What we do is going to be that educational support there. All right, next slide. So in the TASN trauma responsive training that I'm going through right now, and I know Telehealth Rocks is really big on trauma responsive work as well, one of the biggest indicators for success for someone who has had a traumatic background is having that safe, stable, and nurturing environment. And so that is really what we've tried to bring to the youth work that we do. We want to make sure that they feel like they can open up to us so it's safe. They want to make sure that they can rely on us. This is a stable thing. We're going to see them once a week. We're going to see them once a month at community events in person. They know that we're going to be there for them. And then lastly, we spent a lot of time in the Chase program just nurturing them, focusing on their strengths, their interests, their passions, putting some gas in their tank, or as Robert likes to say, they've kind of got the baseline needs met sometimes, but they don't have that higher reaching goal to go for, that dream life. And so we kind of have this chase your dream moniker where it's like, what is your dream? And let's work backwards from there to help you figure it out. Next slide, please. With that, we've developed an 8-week program. These are some of the topics that we focus on. We always start off the program with a conversation about self-talk. And that is because, as we know, a young person struggles with this in general, but especially if you maybe are outcasted by your disability, or maybe you feel like the stigma of being a criminal because you have charges. These are very heavy things on someone. And so we focus a lot on how are we speaking to ourselves in our own minds, and how can we reframe those negative thoughts into positive self-talk. We also focus a lot on gratitude. As we know, anxiety and depression come from focusing on the things that we're lacking in life. And so a lot of times we try to reorient our thoughts to focusing on what we do have, things big and small. And then the fun one at the end, the soul goals, that's, we try to find their spark. So for me, I'm a musician. So my soul goal might be to try to write a song in a week or something like that. And we can share some examples of those. Next slide, please. There's the Chase Your Dreams moniker. One of the ways that we've really been able to tap in with the youth is through our podcast. If you go to the next slide, Christy. We know that there's a lot of time being spent on the phone, and we are like, all right, let's figure out how to innovate around getting through to them on their phone if that's where they're going to be sometimes. So we developed the Chase Your Dreams podcast. It's all 5 to 7 minute long episodes. Each episode has an activity that they can do in tandem with the episode. So for example, in the self-talk one that I mentioned, once they're done listening to that, they write out 3 examples of negative self-talk that they've heard in their minds throughout the course of the week, and then they reframe those. And then if they come back and contribute to the conversation on our next meeting, they can win some gift card money, which is pretty fun. So if you go to the next slide, there's a few quotes, I think. Next slide, please. So these are just some youth quotes along the way. I need to get this updated because we have a lot more, but the youth love the podcast. They love learning from the podcast, and they, of course, love getting the gift card money. And we have a really good relationship with the Department of Corrections in Johnson County. We'll kind of keep them abreast of our goals and stuff with the youth and how they're doing. And sometimes they'll even ante up. So it's been fun. Next slide. We try to take individualized supports approach to each youth. So this just kind of shows a few different examples here. Kylie wanted to be a Navy SEAL. Vinny wanted to run his own car detailing business. For Kylie, for us, that looked like some physical challenges because she was going to be going to boot camp soon. And so her specific soul goal was about setting push-up challenges to get prepared for boot camp. Vinny, we got plugged in with score.org, which is a national organization that helps with things like business plans, because we thought, well, you can't just go and start washing cars in somebody's driveway. You got to think through how this is going to look from a business perspective. So these are just a few examples of soul goals that we've done with the youth. Next slide. Here's another soul goal. Kendall wanted to be a visual artist, and she was having a hard time finding the motivation. So we said, hey, what if we did Chase t-shirts? And so she designed a Chase Graffiti Dude t-shirt, is what she calls it. And we sport these proudly at our community events. And as you can imagine, that validation of, having a hard time working on your passion, now all of a sudden other people in your community want to support you with that goal. And then we actually finish it and we print the t-shirts, and you get to see your friends and your family and people wearing your design out in public is a huge deal for someone that age going through something like that. Okay, next slide. Once a month, we do community events. This was a real fun one here. Brian in the glasses is a friend of mine, and he is someone who unfortunately had a very traumatic upbringing in his life. But Brian took all that pain and he put it into his music, and now he's also someone who has Spotify streams in the millions, and his music is very well known by lots of people. And so once a month, we try to find maybe a location or a person in the community who is someone that the youth can connect with. In this case, Brian came, he played his music, he shared the story behind what the songs mean in between the songs. And we invited the families out, we bought dinner and stuff. So it's just, like I said, it's just to connect. I mean, really at the end of the day in Chase, we're just trying to build connection, and these community events go a long way in doing that. If you go to the next slide, I think there's pictures from various events we've done. This one in the middle with the young man holding the microphone is really cool. That was a collaboration we did with a local production company here called Anxiety and Depression, Just Like You Films. And so we actually had the stars from the film who are Kansas City families come out and do a Q&A after premiering the film. And so anyone in our program who has had issues with anxiety and depression could come out, they could watch the film, and then they could actually ask the families direct questions about how they were able to work through that. Next slide. This one is cool because on the left there, that's actually one of our Fort Scott youth. And we did a bowling night, and he was such a good bowler, they gave him a medal. And we did, let's see, some painting, some pumpkins. I was at a bonfire over the fall. So yeah, it's just, you know, we like to have fun in our program, and we like to create connection and create positive memories and give the families, you know, something to look forward to. And that's become a big part of it. Once a month, we'll do these. Okay, next slide. More events. Unlock Your Future, that one was with VR. So that's an example of one that was, I would say, more training oriented. Whereas the bonfire and concerts and stuff, that's usually just more like, hey, let's get together and have a good time. All right, next slide. So I threw in some slides here towards the end about a new kind of offshoot pilot program that we're running in Mill Creek, Olathe, which is an Olathe alternative school right now. It's called JAM. It's called Just Arts and Music. And this was a unique opportunity that we had to collaborate with Art as Mentorship. Christy, if you go to the next slide. And Art as Mentorship is a Kansas City local organization that supports songwriting with youth. And these are some actually personal friends of mine. Like I mentioned, I'm a musician, and so these are just people that I knew, and we tried to get a grant together. The grant didn't work out, but we decided, hey, what the heck? We've got this school that's really interested in this. Let's try it anyway. And so this is currently happening. We're about 2 weeks out from wrapping it up. And the first 4 weeks of the program, the students write music together. So they sit down, they learn the basics of writing a song. And then weeks 5 through 9, we treat it as if, okay, what if you were in a band? What would you need next? Well, you would need an album cover. So now they have to collaborate on an album cover. They also do merch design, so they'll have a chance to create their own t-shirt, which will get printed up. And they have also, and at the very end, and some of the guys are really excited about this, they're going to do a podcast. And so Friday, actually, this week, we're going to film a podcast. The students are scripting questions where they'll be kind of detailing their experience in the program, talking through what was this actually like to show up to a recording studio and write a song, and what was this like to have to, you know, work through collaborative aspects like, hey, maybe my idea, I love my idea, but someone else loves their idea, and now we have to work together to make one idea happen. Next slide, please. And I know excessive absenteeism is a huge concern. And one of the biggest drivers for making this happen was to see how this would impact attendance. And we don't have the complete data yet because it's not quite over, but just the other day when we were talking with the principal, he said that without a doubt, this program has increased attendance, and they'll get us that actual data. And I said, can I please get that in all caps for the next time we're going for a grant or something? And he was like, yeah, for sure. But yeah, I think, you know, with Chase and with Jam, and we try our best to just build connection, and we try not to overthink it. And we try to let the youth lead the conversation a lot of times. So a lot of the podcast episodes we're getting to do are topics that they chose during our leadership meetings. And we went bowling because that's what they said they wanted to do. And we're trying to get them to school with something exciting, like writing a song, something they might do on a weekend with their friends. So we know that there are these core elements of just being a human. We know that we want to feel connected to others. We want to feel like our ideas are heard and validated. But we also know that it's a bit of a moving target to help people. And so we just try to do our best to listen and respond with the programming in that way. Next slide, please. If you keep tracing your dreams, one day you'll catch them. We really do believe that. And I think the next slide has my contact information if anybody's interested in anything we're working on. I will also, before I still got the microphone, I will drop in the chat here. This is a song that we made with the Mill Creek students. So if anybody wants to open that up, you're welcome to. I'll share more of the visual assets and stuff later on as we get them, but this is an actual song that just got made a few weeks ago. So thank you so much.
Thank you guys so much. I like people who think they can change the world, because we got to change things for kids. I say that all the time, that we've got to change things for kids. Next slide, Christy. So I want to start, before we get into the questions we've kind of prepared, to find out what questions other people have. And Anita Cooper, that's the only one I caught, but there may be others. She was interested with the RJA about, I don't know, Anita, if you want to unmute, or I can try to make a
Sure,
swig at it.
no, thank you, Robert. So I was just curious to know if our family preservation or our foster care providers, TFI or Cornerstones of Care, makes referrals to that program. It sounds really awesome.
Yeah,
Same
great
question
question.
for Chase. I mean, Chase program too. Thank you.
Yeah, thanks, Anita. I appreciate your question. It's good to see you again. Yeah, we do accept referrals from family preservation and TFI. We get referrals occasionally. Would always love to increase our partnership with them. I think it's wonderful. I've been to TFI a couple times to make presentations on our programs. I don't think I've had the opportunity to go to Cornerstones of Care. So if you've got a name of anybody that I should reach out to there, I'd love to go meet with their case managers, with their family preservation specialists, to talk about what we can do and how we can work together to serve those children. Because as you know, a lot of our youth are crossover youth in one capacity or another. So the more we can work together, the better off our youth are. So.
And I have to give a shout out to Tabitha Gibson from TFI, because I wouldn't know Anita or Michelle or either, because Tabitha, we had met with her early on. She is vice president for, I can't remember what, but she's someone important at TFI who someone made a link actually from Community Health Center. If you haven't noticed, everything, I'm a very relationship person. People say, hey, we try to bring everybody into our tent. That's another one of our big themes, that everybody belongs here. If you're involved with kids, you belong in our tent. And she said, hey, you need to talk to these guys at Southeast Kansas DCF. You need to talk to the guys over at RJA. And so, these connections and people working together, because I really do believe there's enough resources. People probably think I'm naive, but I know how much money we're spending in this system, and we're not meeting kids' needs because we're not coordinating, we're not talking, we're not collaborating. And it's not that people don't want to, they absolutely do. Really, one of the goals for this whole series is, how do we connect schools in their community and the people in their community they need? Yeah, Sandy Emerson, you're right. Tabitha is great. So are there other questions before we move into kind of the ones that we wrote? Sorry, let's move on to the other questions, and I think that may bring up some questions people might have. So how do you guys, both Michelle and Brad, how do you engage with youth that are at risk for involvement due to things like absenteeism or problem behaviors or other issues? Let's start with Michelle.
Great, thanks, Robert. Yeah, so whenever a youth is referred for our program, they typically meet with either Pam or Jeremy, the youth and the family, to kind of discuss what's going on. What are the issues? What do they want to work on? How can we help? And so really we try to engage them by getting their input. What are their strengths? Where do they excel? Where might they need a little bit of help, and how we can provide that for them. So it's really family and youth oriented and focused on what they want to work on in conjunction with what they were referred for. So sometimes we may have a youth that's referred for, let's say, mentoring, and then we get in there and we meet with the family and we find out that really that anger management or that substance using part is really the driving factor behind some of the behaviors. We might recommend that we focus on that first to help that youth, and then perhaps pursue the mentoring down the road. So we really listen to what the youth and family want and what they feel would be appropriate before we put them in any program.
Yeah, I would say we have a very similar approach, really. And in case it wasn't clear, in Kansas City, the referrals have to come directly from the Johnson County Department of Corrections. And then right now, we're also in Fort Scott, Kansas, with the help of Destry Brown, who's the superintendent there, and at the high school. And so those referrals come directly from Destry, the superintendent. Hopefully one day we can accept referrals from anyone and everyone, but so far that's how we get them. And yeah, we have a very similar approach. The very first conversations that we have with the youth and families are just kind of get to know you conversations. And it's very much so strengths, interests, and passions oriented, definitely, like Michelle mentioned as well. There's enough going wrong in their lives already that we don't want to stack upon that. And so we get the fun job of digging in with things that they're interested in. And generally we see that starts the whole program off on the right footing.
Well, I'm going to hit Brett up again and move to the third question. So how do you both build relationships with school districts, with personnel in the school district, especially in Johnson County, where the referrals are coming out of the justice system, not the school district, but also how do you get to know the community and the community organizations that might support your work?
Yeah, good question. We have what we call the Chase Toolkit, which is the podcast booklet, as well as the power cards that we use, and a transition notebook for transition age youth. And we offer that to 5 school districts every quarter. And so we go out physically to the school and we meet them and we say, here are these resources that we've created that you can use. And so that's one way that we've done it with the districts. Being in the IEP meetings and the planning meetings helps a lot in that regard. As far as community organizations, a lot of it is just being out in the community. Like I mentioned, the events are really helpful for that. In Fort Scott, we asked the locals there, hey, where do you guys hang out? And somebody mentioned this coffee shop. And so we picked up the phone and we called the coffee shop, and they helped us schedule a local musician, and we got families out for a little hangout there. So it really is just a matter of getting out into the community and networking.
So Michelle, how do you coordinate with your program? What level of coordination or integration or even communication do you have sort of with school staff or programs at the schools, especially when you're talking about the truancy prevention and intervention program?
Yeah, that's a great question. And kind of just to build off what Brad said, I mean, that networking, those connections are so important. Fortunately, I've been around RJ for a long time, so I have a lot of personal connections with our schools and with, TFI and DCF. So being able to reach out and get into, and talk about our programs. I have an email list for anyone that's referred for our programs in the past, and local school counselors and school resource officers that I try to email out about once a quarter, just as a reminder, here's what we can offer. If you would like me to come make a presentation, I'd absolutely love to do that. Building calling up, I know several of our SROs in the community, so call them up. Hey, how can we help? What are you seeing in the school? What's being referred to you? How can we do that? With our truancy intervention program specifically, it's building that relationship with the schools. It's our truancy coordinators getting in there, meeting with the school counselors, meeting with the teachers, finding out, hey, what's going on with this youth? What are you seeing in the classroom? What are you seeing in the school? How's the communication with the family? What can we do to kind of bridge that gap? Are there barriers maybe the family's facing that the school's unaware of? For instance, like maybe their car, is not running, and so maybe we need to help set up bus transportation, and families don't know how to do that. Maybe our kids are not getting a good night's rest because they don't have a bed at home. They're sleeping on blankets on the floor. So we're able to coordinate with local resources to get beds for the family and improve that. So I think just basically making sure that we're all working together. And Robert, you said it best. I mean, there are a lot of resources out there. And I think that, we all need to be communicating and working together. And the more we can do that, the better off the youth and families are in the areas that we live.
And I think you really began to hit on, how do you help students, their families overcome barriers? But Brad, if you want to talk a little bit about coordinating, but also overcoming barriers, I think those really kind of come in line with each other.
Yeah. Oh man, that's a tricky one because it's a case by case thing, I feel like. I think a lot of it just comes, as far as the families go, a lot of it comes to just having that extra support. And so I mentioned it in the presentation, but having someone to go through the IEP, especially if they're new to something like that, and just parse it out and say, what does this word mean? And how would you reframe this so that it's more beneficial for my child in an educational setting? These are things that a lot of families and guardians just are totally confused about, and understandably so. And also, there tends to be every once in a while a little bit of, I would say, a resource fatigue, where maybe they're confused about, if you think about someone who their child has a disability, so they might have an IEP at school, they might have a justice plan, they might have had trauma in their life, so they might have the new trauma responsive support planning document that's going to be, across Kansas soon. And that really adds up. So just to have a point person to ask questions and to help them understand that this program is for this and this program is for this, and not sending them a bunch of different directions, is very, very helpful for them. There are also little things that we do, like a physical barrier, for example, with transportation. A lot of times we'll offer to pick up families to go to our community events if we're able to. That's one way that we've been able to overcome something like a transportation barrier. And I forget, the first question was about coordinating. Uh-oh, you're muted.
Sorry, just what do you think is important when you're coordinating a program like this? Especially because you have experience where you partner with Justice, but you're interacting with the school, and then in Fort Scott, and that's up in Johnson County, but then in Fort Scott, you're interacting with the school and then trying, but so what would you think is, what was useful, or what's best for a community-based program that wants to support a school and education?
Well, I got to shout out Fort Scott, because it's totally informing how we're going to move forward with Chase. We have the access to a community health worker there through the help of Telehealth Rocks, and her name is Heather. I think she might even be on this call, but we're able to interface with the community health worker in such a way that she has access to the home and the school, and that helps a lot with even just scheduling, which is a huge barrier to get in for these meetings, especially if we're going to do 8 weeks of them. And she also communicates when something's going on. So maybe, she's going to know if there's a bed bug problem at home. She's going to know if there's a big blow up at home an hour ago. And so just that open communication is really important. I would say it's the same with the justice system here in Johnson County. We've run goals with students where it's like, the goal is to be at school on time 2 days this week, just 2 days. And we'll reach out to the court services officer and say, hey, just so you know, this is happening. They can say, okay, great. We'll provide an incentive for something like a curfew at night. So working together through that open transparency helps immensely. And it's like you always say, Robert, we're just trying to connect this big node, all these nodes, right, into one big kind of tapestry of support. But if we're disconnected from each other, it's not going to work. So we're always erring on the side of over communicating.
And I do want to add one thing. I think this series is going to build on each other, because both community health workers, which we talked about last month, but also we have a really strong relationship with MHAT across all the school districts in Southeast Kansas, but the CHW in Fort Scott and the MHIT liaison share an office and they communicate. So not only is it then youth with justice issues or attendance issues and the community health worker working on social needs of the family, but then you also have the mental health intervention team staff that work on mental health needs. And, step by step, we're just going to keep going until we have a network where we have an actual system across everything. That's the only thing that will be successful is everybody working together. So,
I
and I'm
think,
gonna,
Robert,
please go ahead, Michelle.
sorry, I think
Yeah.
too, it's huge for us to keep in mind when we're working with youth and families. I mean, we all are ingrained in our work and we do it every day. So we understand the acronyms, we understand the different things with the schools, 504 plans, IEPs. We might have an understanding, and to give those parents and youth back a voice to advocate for themselves, to help them understand the things, because I think sometimes, myself included, we can get a little jaded because we know a lot about the different systems, and so we're talking in a way that we expect the parents and youth to understand. And so sometimes just breaking it down to really sit through and explain what we mean and why this is important for them, so that they can, because it's not just while we're with them, we hope that we're springboarding them to advocate for themselves long after we're out of the picture.
And we only have 4 minutes left, and I'm going to ask you guys the hardest question yet, which is, if you had one piece of advice that you wanted to offer to someone working in a school or the community, and they really wanted to impact truancy, behaviors, or other issues that stand in the way of kids being successful in school, what's your advice? And I know I say one, but you can say what you want. I'm not going to make you come up with some aphorism that we all should live by, although I wish you would, because we need one.
I'm gonna say, just get creative. And I know there are already so many creative things happening, but this jam project was just a total gamble. And the Mill Creek Olathe school was just really flexible. And they said, we have a truancy issue and absentee issue like everyone else. We're willing to try something new and we'll see if it works. And it's working, and we're lucky in that way. We worked hard on it, but it was through that flexibility of the school willing to try something new, something that, they're even getting, I think, creative writing credits through things like lyrics. That is not something that was ever a thing when I was in high school. I don't know about you guys, but they're willing to try something new to at least get the students there. And then once the students are there more, then they can, participate more in the other activities. But yeah, just keep it creative and be willing to try something new, even if it doesn't work.
I wanted to say that Felicia Cunningham said be proactive, which I agree with. Anita Cooper from DCF says listen to what their needs are, not what you think they need. But I'm going to let Michelle sum things up, and we're going to close this out with just a couple minutes left. And yes, Felicia, we will be sharing all the recordings.
I would echo what Brad said, get creative, and also just focus our work through a strength-based lens. Focus on the family, focus on their strengths, because if we focus on their strengths, then we can work together to remove those barriers. And specifically for schools and those in the community, know your resources, work together. You don't have to do everything alone. We're here to help. We're here to help some of those issues. You've got kids that are struggling to just maintain in the classroom because they're, having behaviors all the time. If you can refer to a local service, like ours, maybe we can give them some tools to, better handle their impulsivity and their frustration. So yeah, just that strength focused lens, I think, is huge.
Well, I want to thank everyone so much. I'm loving this series. I am so pleased to have such amazing partners and be able to kind of present them to a statewide audience. I can't wait till next month. We're going to talk about youth impacted by child welfare and the foster care system. That'll be on March 26th. That will have Southeast Kansas Department for Children and Families presenting this amazing Agencies Working Together program and some other work. And then also Foster Adopt Connect, which we're so pleased to have as a partner. Everything will be sent out to your email. It'll also be on our website and on our Facebook page. And we will send out links and all the information we can pull together to everyone from this. We know there's some amazing things and all the great programs that both Brad and Michelle talked about. We'll try to get those out. I hope everybody has a great day. And thank you so, so much for coming. And also thank every one of you for the amazing work you do with kids. We all are here because we care about kids and we want them to be successful. And we're so pleased to have you partnering in these trainings and in our work. So I hope everyone has a great day.